Hello, my name is Dr. Maduka Ogwueleka. I'm making this video for a group called Oche Kitchen. I presume Oche Kitchen is an Igbo group, and for that reason, I'm going to speak both English and Igbo, because I'm an Igbo man and I'm very proud to be an Igbo man. So I'm going to mix my English with a bit of Igbo language so that some people can understand it a bit better. Today I'm going to talk about hypertension. I've been a doctor since 1997. That's a long time ago. I'm a member of the Royal College of Physicians in the United Kingdom. And I'm currently a consultant physician at King Khalid Hospital in Saudi Arabia. So hypertension is a deadly disease, like everybody knows. But how deadly hypertension is, a lot of people are yet to appreciate the extent to which hypertension can damage the body. It would interest you to note that hypertension kills many people every year globally. It kills more people than tuberculosis and malaria and typhoid fever combined. Hypertension is the commonest risk factor and obviously the most important risk factor for what we call cardiovascular death. In other words, the heart stops beating, okay? So hypertension can also damage other organs, what we refer to as vital organs, such as your brain, your eyes, your heart, and your kidneys. And it does this very slowly. So slow that you may not even appreciate that something is going wrong within your body. A lot of people tend to think that hypertension has symptoms. Unfortunately, hypertension does not have any symptom. Some people say, "Ooh, well, it can cause headache," but from research, we have discovered that the headache of hypertension is no more greater than in the ordinary population. So, how would you then discover whether you have hypertension or not? If you wait for symptoms, it may be too late. So you have to go for regular check-up. I would advise you go for check-up every 3 years. Okay? Now, what is hypertension? Kedu ife bụ hypertension? N'ala Igbo, anyị na-akpọ ya ọbara mgbali elu. Hypertension is impossible to define. Impossible. Because what is hypertension for one person is not hypertension for another. What is hypertension for a particular age group is not hypertension for another. What is hypertension for a particular race is not hypertension for another. But we have an overall, what I would consider an overall value that will say, oh, at this level you should consider that you have hypertension. And we have taken an arbitrary value of about 135 systolic over 85 diastolic. Now, kedu ife bụ systolic, kedu ife bụ diastolic? When your heart goes boom, pumps, that will determine your systolic pressure, the pressure at which your heart is pumping blood around your body. That is your systolic blood pressure. And that number or value is recorded on top, what we consider in mathematics as the numerator. And then the diastolic pressure is the pressure your heart is carrying when the heart is relaxing. So it relaxes and pumps, relaxes and pumps. When it pumps, it determines the systolic. When it relaxes, it determines the diastolic. So, ijenu na ọgwụ doctor edere gị sị gị na blood pressure gị 120/80. If a doctor na-akọwa gị na your systolic 120, your diastolic 80. So, enwe systolic hypertension and also diastolic hypertension. Systolic hypertension is as bad as diastolic hypertension. When keki be enjo, they are both equally bad for your body. But everybody with a blood pressure systolic of 160 over diastolic of more than 100 need the treatment, irrespective of whether there is any other associated risks. But everybody above the age of 50, need the antihypertensive drugs. Whether my blood pressure got a normal, moderate normal, you will benefit from it. And this has been confirmed through a lot of research. And this is evidence-based. So, you have 50 years and above, you can on at least 1 or 2 antihypertensive drugs, irrespective of what your blood pressure is. Okay, this may surprise a lot of people, but this will prolong your life. Now, kedu ka isi eme investigate onye anyị na suspect na onwe high blood pressure? There are so many tests that you need to do, and your doctors can arrange that. You can see check your blood sugar. In addition to checking your blood pressure, you can see check your blood sugar, or what we call blood glucose. Okay. You can see check your kidney function. You can see check your cholesterol levels. All everybody available, you can see me chest X-ray and ECG. Chest X-ray will X-ray the men on your chest. Okay? ECG and check your electrical activity of your heart. All available, you should also do what we call an echocardiography. Okay? An echocardiography will ultrasound scan of your heart. Tell you whether your heart valves are working, whether they are not working, whether they are in danger, and so on and so forth. So, blood pressure use abo. Nke na primary hypertension and nke na secondary hypertension. Primary hypertension affects 95% of cases of high blood pressure. In other words, 95% of cases of high blood pressure are primary. So only 5% bunkaina or secondary hypertension. Primary enwegi cure. You just have to control it and regulate it with blood pressure and dieting and exercise and so on. Secondary hypertension, you can cure it. And secondary is usually due to kidney problems, more endocrine problems. Endocrine, the ductless glands. So problem with your pituitary gland, problem with your thyroid gland, adrenal gland, and so on. But although they're common, so I'm not going to be discussing secondary hypertension. We shall concentrate on primary hypertension because all you catch a boom mad and all you catch are common. Okay? Now, before you build blood pressure tablets, you must control other risk factors that can damage vital organs. So blood pressure will damage the brain, causing stroke. Blood pressure will damage the heart, causing heart failure. Heart attack. It can also damage your kidneys, causing kidney failure or kidney disease. It could get so bad that only we can self non a dialysis machine just from high blood pressure damaging the kidneys. Okay, so you lose your weight. So how do you manage? You need to lose weight or only broke. ị na-edere kwụsị ịṅụ siga onye na-aṅụ oke siga, ị na-edere kwụsị ịṅụ oke alcohol, ịṅụ mmanya alcohol. Okay, in fact alcohol is one of the causes of secondary hypertension. So ịkwụsị alcohol enwere ike blood pressure ga-agbada, especially for ndị na-aṅụ oke mmanya. You reduce all your salt intake, nnu a na-etinye na nri, reduce all the quantity you na-etinye. Avoid it if you're hypertensive, or tinye as little as you can manage. Okay, so and then again, iri oke mmanụ, what we call high fat diets, you have to avoid them as well. Now, how do you treat them? How do you treat hypertension? KKC treatment. Doctors na-enye ihe na-akpọ antihypertensive drugs. Okay. The current guidelines suggest ka anyị na-use ihe na-akpọ A, C, and D. We used to do A, B, C, D. And I didn't mess it because B, which I will explain shortly, can cause diabetes. So for that reason, it will get from the list. So A stands for angiotensin converting enzyme inhibitor, or ARB, angiotensin receptor blockers. This is A. B will beta blockers, but I had to use the beta blockers. We used to use atenolol, but on cause diabetes, so we'll get now. C stands for calcium channel blocker, and D stands for diuretics. For NDOG, black people, you must do a combination of calcium channel blocker and diuretic. Must. Because evidence suggests that black people, the main cause of our problems in diabetes is fluid overload, volume overload. More. To remove that water and reduce your blood pressure, you need to be on diuretics. Okay? So ARB include drugs like valsartan, telmisartan, okay, losartan. ACE inhibitors include drugs like lisinopril, captopril, enalapril, and all the prils. But AC inhibitors, all these enalapril, captopril, and dotia, can cause lung cancer. When I cause lung cancer, cancer of the lungs, if you use it for a very long time, when I cause chronic cough. So for that reason, I don't give that to my patients. I go for ARB, something like valsartan, if I must use it. We usually add A, or diabetic, in addition to being hypertensive. Okay? So, calcium channel blocker, we fedica, amlodipine, nifedipine. And then diuretics. And with thiazide diuretics, and with potassium sparing diuretics, honey ladies are good. When you're on a diuretics and no more, you go see your doctor. They check your kidney. They check you see each other because some more go down with side effects. Okay, so this video has in 5 minutes, but hypertension will be a big topic. I cannot do it under 5 minutes, not impossible. And this is now 13th minute or so. So I will leave it at this. One question, you can forward it to coordinators of Oche Kitchen, and then you can get to me, and I'll give you answers to your question. Bye.